I wanted to just talk about what the new thing we're doing in the clinic starting January 1. And actually, it's kind of partially starting in December, mostly because there's not that many days in December, and we're going to have training days and things like that. But I was approached by SolidaritUS in August to join them, and they are a company that's a nationwide company. Is the noise maker on, or is that
no? It's the team.
Okay. They're a startup company that's looking at ways to bring better primary care specifically to employers, to lower the cost for healthcare and to help with wages. So their first people that they've worked with are mostly labor unions, and they are coming to Eau Claire specifically with a contract with group health insurance. And so, welcome. If you want to grab one of those chairs right there, you'll be all set to go. Would you like something to drink?
No, I would.
Okay. There you go. Okay. So stop me at any time if you have any questions, but I thought I'd just run through the basics of it. They approached me, and I really wasn't looking to change anything with my clinic, but Lisa and the rest of the team and I in April had gone through kind of what our 10-year goals are, our 3-year goals, and had a quarterly meeting. And the 10-year goal was to get to a clinic that was sustainable, that was paying us a reasonable wage, that we had benefits, that our patients were happy, we were happy, and that it was a way for other providers to more easily exit the big systems. And so when SolidaritUS came to me and they said, you know, we get that the relationship-based care that you're doing is the way to go. It's the way to prevent people going to urgent care and emergency room and a bunch of specialists they don't need. And so we'd like you to come and be the anchor physician here. And I said, well, maybe, tell me more. So they said, you know, we understand that you need a lot of time with your patients. And so we have 45-minute appointments, sometimes an hour. We make sure that that you're supported and that your panel is small enough that you can provide this world-class care. And so so I thought about it, and I thought, well, it really kind of meets my 10-year goals in a much faster timeline. I just have to be okay with not having the same logo on the door. And it's a little hard, you know, those of you who have had your own business, it's a little hard to think of giving up your baby, but ultimately, you know, to kind of do the part that I really love and have somebody do the other part, which is, you know, talking to groups and recruiting people, it made sense. So, and it made sense not only for me, it made sense for you guys as patients because it offers you more benefits. It made sense for the staff because they get better things, and it just is more stable in the long term. So, you know, healthcare is changing all the time. The cost of healthcare is much outpacing inflation every year, and so it's great to have a little reboot of the system and in our little corner of the world. So that's what SolidaritUS has kind of, you know, brought to the table. They have 3 employers that they're working with through group health, and so they're all going to be offered right now open enrollment, whether or not they want to have the DPC. And the average panel size in this part of Wisconsin is between 3,000 and 3,500 patients. That's the average primary care doc has. I personally, in the last year, have seen about 850 people. Over the last 6 years, a little over 2,200 people. And I purposely have kept it lower than the average. And it will be, I will at the maximum be 1,000 people, more likely around 800 people with SolidaritUS. So it'll be very similar to the pace and the care that you've had here. It just will be a different mix of people than we've had. So yeah, they're actively recruiting for the second right now. So this is the temporary site because it's a pretty aggressive timeline to open January 1st. So this will be through sometime in March. I think realistically April. They think maybe March 1st. like April. So it'll be here, it'll be the same. And then River Prairie, above and across from ZA 51 is the location in River Prairie. The location of River Prairie is about twice this size, and it's made for 2 MDs and 4 support staff. So Lisa, Matt, and Michaela, and then another MD and another MA will be the complete unit, and it will never be bigger than that. There'll never be more providers. They'll open another site when they get to the 3rd provider. So it will never be like you have 16 people possibly that you see when you come in. I don't know if I can. Maybe I can. I don't know. I can tell you maybe off screen. So I can tell you that the 3 employers they have 2,000 people total that can choose whether or not they join or not join. And so we don't know how many of them are going to choose it. If everybody picked it, then 2 of us would be full up right away. But I think realistically, maybe a third will pick it, and I'll probably get close to full in the first year, and the second person will take longer because most likely the second person won't be native to Eau Claire. Because anybody working here has non-compete like I did. You have to go 25 miles away for over 2 years. So that's my guess, but they're pretty convinced that the second person is going to come on board pretty quickly.
What type of oversight does Group Health have over SolidaritUS?
So Group Health has nothing to do with our patients. So SolidaritUS, in order to recruit me, said, we understand you want to keep your patients, so we'll take whoever wants to come. But they have to be in the membership model because that's their model. So that's why they're coming to Eau Claire, because they have a contract with Group Health to provide care for 3 employers. That Group Health has their overriding insurance, and the DPC is part of that insurance. So it has nothing to do with my patients, unless perchance you maybe have Group Health. But there's not really any relationship. That's just why they're coming to town to start with. So they were going to come to town no matter what, with or without me. They were just going to bring a different doctor in. And so the opportunity for you guys is that, you know, those of you who have been Circle members have paid $199 to join and $75 a month to be in the Circle. And you know about unlimited visits and virtual visits and being able to, you know, send pictures and that type of thing. The new added thing is what's on your white sheet. So there'll be about 11 labs that are included, and this is a preliminary. This is what they're doing currently at their other clinics. I will have some say over time, so that list may change, but these are their like most common generic medications that they include, because how it works when they work with an employer is they pass the wholesale price on the employer, but you guys aren't an employer and they're not going to pass the cost wholesale onto you because the logistics of it make it into another big system. and so what we did is we kind of extrapolated and said, okay, you know, how close can we keep it to the $75 a month and still offer similar services? So the generic drugs on the list are the ones that they include and that we will dispense right from here. So if, for instance, you come in with a sinus infection and you need amoxicillin, you'll walk out with amoxicillin. You won't have to go to CVS or anything because it will be here and available and included. If you need your lipid panel done, hemoglobin A1C to look for diabetes, those will be included. And then the other lab tests, for instance, I do vitamin D levels a lot. Right now, that's an $80 test here. It's about $350 at the big systems around town. And our Circle members pay $60 for it. It sounds like it's going to be under 30 with them. It might even be 20, fingers crossed. So that's just an example of what some of the savings will be. And so it's been a little bit of a logistical thing because all of their clinics before were not people currently with a DPC. They were people that were leaving big systems. And so they didn't necessarily bring their people with them. And they actually, unfortunately, don't care about bringing in my people from a monetary standpoint. I mean, that's fortunate, it's unfortunate, because they didn't want to pay me for my clinic. So, but they do understand that I have relationships with people and I want to bring the people I know. So if I'm going to have 800 people, I would like to know a fair amount of them already. And so that's why we're kind of, you know, having these informational sessions and getting the word out, sending out letters and Facebook and all that jazz. So I think that's kind of things overall in a nutshell. So I just wanted to open it up to questions. Go ahead.
In my situation, is the cost of this a business healthcare cost books?
Well, that would be an accounting. That would be an accounting question. Yeah, depends on what kind of corporation you have and what. Yeah, so I don't know, honestly. I think that it's important, you know, right now everybody's top of mind, like, what am I picking for next year?
You guys mentioned that, you know, their business is kind of to supply healthcare for
Employer
their
groups.
priority is to supply healthcare for businesses.
Yeah.
So therefore, just how, you know, then I thought that they would know.
Sure.
If it falls under the umbrella of that type of expense.
And they may know that, and I can definitely ask them back to you, but I don't know off the top of my head. And
yeah,
my business experience with accountants is the answers vary.
Yes.
So talking to your accountant might be the best. Or getting a new accountant. That's right. No, I don't know. So I think, you know,
it's a big question, though.
Yeah,
Absolutely.
Absolutely. You know, I think one of the big things to think about when you think about whether or not you want to join this is, you know, if on January 15th you end up going to urgent care, you're going to pay the whole year's worth in probably one visit. Or if you go to the dermatologist once, you know, so I think we got to keep it in perspective of what healthcare dollars are.
Oh, yeah.
And so even though we all, you know, are doing our budgets this time of year and think about $81 a month, it's healthcare dollars seem to be different. And so, but that's a great question, and I will try to find you an answer. But sure, yeah. Anybody else?
I have a question.
Yes.
I know in your letter you talked about children free, and I'm assuming children is under 18.
Oh, yes, and that is actually for 2019. If people are already in the circle, already paying $75 a month, then they just change to $81. So if they're paying $75 a month this month in December, it's just going to change to 81.
And if we're not, then we're paying the $299 to start over and then going to the 81.
Right. Correct. Yeah.
If we wait until January, it's only about $199.
So right, and so
That sounds cheaper to me.
yes, except that it doesn't include November and December. So actually, if you sign up in December, say you just signed up December 15th, it would be $199 plus 75, which is $274, and then on January 15th you'd pay $81. So it's really the November part that you're getting for $25 instead of $75. Does that make sense?
Yes.
Okay. So.
I'm going to ask a bunch of dumb questions because I really don't understand health insurance either. So
Oh, sure. Okay.
see if anyone else asks them, and then I'm going to ask you the dumb questions.
Well, there's no such thing as a dumb question. Thanks for coming and asking them. Okay, who else has a question?
If you need to go to a specialist.
Oh, yeah.
Right.
Mhm.
What, how does that work? Is that the same?
Sure. Yeah, so, you know, this is specifically for primary care with me, obviously. I don't have any affiliation with anybody. So as far as sending to specialists or for mammograms, or, I mean, certainly we talk to people about what's covered under their plan or try to find them the least expensive option if they're paying out of pocket for those things. But there's no further kind of steering one direction or another.
So we work the same way, they're not affiliating with any particular people
Correct.
here.
Yeah. In fact, they actually have some other things that to look for quality value versus just arbitrary referrals. So yeah, so I'll have access to that information. So, be able to say like who's had great success with hip replacements. Knock on wood, nobody needs one of those. So, but
Do you have any X-ray capacity?
no, I do not, and never will. Yeah. So, but we do. We send people for various things like ultrasounds and MRIs and things like that. But ideally, a lot of times you don't necessarily need that imaging until you're at the point where you're going to see the specialist anyway. So because you're kind of proving that you need surgery or whatever with the imaging. So
Does this insurance then pay anything towards, say, a mammogram or an X-ray or not?
well, it does not, because this is not insurance.
It's not insurance.
It's not insurance. Yeah.
What is it?
So this is a direct primary clinic, a primary care clinic. And so it's really, I guess the best way to think of it is you can get a really high deductible plan and the DP and never trigger the deductible because you have this direct primary care instead. But if you have your appendix out, then you will need that insurance. Or if you
So people would tend to pair this with maybe a high deductible insurance?
exactly. Mm-hmm. Yep. Exactly.
So this isn't insurance, what is
This
this?
is a direct primary care clinic. So it's meant to,
It's a membership in a clinic.
it's, yeah, mm-hmm,
All right,
yeah,
we have a name for it now.
that's right. Yes, and there's videos on our website if you want more information about that. I mean, we've been doing it for a while, so.
So Solidaris is Solidaris. Anyway.
SolidaritUS Health.
Okay.
Yes.
How big is that?
Uh-huh.
I mean,
Uh-huh.
I just looked on the web a little bit, and it
Sure.
was something about Oklahoma
Yes.
was
Uh-huh.
kind of where the base was, and
Right.
I had the impression that it wasn't all over the country yet.
Sure. Yeah.
You said something about a startup, didn't you?
Yeah. So it is a startup.
Tell us about that.
Sure. Yeah. Absolutely. So, so the CEO and the CFO, Mike Capsa and Mark Bloom, are actually economists, and they're in Washington, D.C.
Okay.
And so they have worked as consultants with direct primary care clinics for about 10 years and decided almost 2 years ago to open their own in effort to mainly work with labor unions. It was kind of their first initiative, but they, let's see, where was I going with that? CEO, CFO, Washington, D.C., Oklahoma, Spirit Aero Systems in Oklahoma was going to move 4,000 workers to Malaysia, and they were able to help them stay in Oklahoma by opening and helping their healthcare costs be less. And so they went to a high deductible plan with this DPC component, and they opened 3 sites with 4 docs about 2 years ago down there. But the company that they hired to help them start is called Activate Health, and they've been in business, I think, 11 or 12 years, doing mostly on-site clinics. So like taking a nurse practitioner and putting her in a place like Presto or Drylock and having that person see the employees. And so that's where the Activate Health is kind of the backbone supporting SolidaritUS. But they opened in Oklahoma. Now this relationship with Group Health is bringing them here to the Chippewa Valley. I don't know if you know that the Chippewa Valley is one of the highest cost places for healthcare in the country. So it makes sense that they would come here next. And then Northern California is what their next project. They're looking at opening 6 sites there in the next year. And I'm not sure of the details of that because I've had enough details of my own. so it's interesting that they're economists and they look at things very differently. Their chief medical officer, she's a DPC doc down by, she's in Delafield by Milwaukee. And so they're kind of the core team. So I like to have, predictable costs for people and relationship with people so that if they call me on a Sunday and say, this tick is on me, what should I do? I can do something because I know who they are, and rather than just be like, I think you should go to urgent care and they're going to do a bunch of tests. And so, although sometimes you need that when you have a tick. So, other questions?
So is this the only way we're going to be able to see you is to join the plan?
Yes. Mm-hmm.
Okay.
Yes. My plan is to shut down the clinic, the Joyful Eye Clinic, December 31st. We're not really going to see non-members in December unless there's a special instance, although Carrie Crank, our nurse practitioner, will on Thursdays still see people in December. Yeah, just mostly because it's the way to stay open. I have had some people that have been concerned emailing me and saying like, can't believe you're not going to stay open and do this. And then I look in their chart and it's like, well, you came once in 2016. Your $100 is not going to keep me in business. So that's part of the reality of it. So, and for me, it's really exciting to be able to have people come back just because they need to come back rather than have to like, should I pay the money or not? It's really exciting to be able to think we could get, 10 people with diabetes in a room and talk about how they shop it and how they do their food planning together. And we don't have to care about making sure everybody gets billed and everybody gets their money. It opens up a lot of more community-based kind of work on stuff. So that's one of the things that I'm excited about. I had no idea how much anything cost. And there was really no way for me to find out other than what my patients would tell me the next time when they came back. And so this is a very much more transparent way of care. And it's also, it hits 80% of what's going on with people. And so it's never going to be 100%. That's why we have insurance companies. And so it's kind of a return to more old school kind of.
We can pay you with chickens then?
Through December. Or we'll get a new freezer if you have them. That's always what I said. I'm going to leave and just go trade for organic chickens. I have gotten some maple syrup.
Yeah.
And I did get some organic beef once.
Yeah.
I have yet to get a chicken. I should before December.
Eggs.
Yes, she brings me eggs.
I
The best
do.
little,
I bring you
cutest little eggs. She's got this little egg apron.
It is pretty cool.
So, in a way, I got potential chickens out of the deal. So good. Yeah, so it's a kind of a return to the old school family doctor. So, other questions?
Question.
Sure.
What's the window of the time frame during which we could join this before we maybe couldn't?
Well, that is a very good question. That has to do with how many people. So, right now, if you got our email, that email went to about 2,200 people. I'm expecting that probably between 150 and 200 people that I've already seen will come with me. And then I think probably the other 600 to 800 will come from those employers that Solidar's working with. So I think sometime in this first year, it won't be a possibility to see me, but there'll be another doctor that you could have the same. Well, that's not even actually true because they're only really going to let my people come because they've seen me. So if you've never been seen here, you would want to be seen sometime in the next couple weeks. Because if we don't have an established record for you, then it's not going to be open to you. It wouldn't be open to you otherwise. So unless you went to work for one of the employers that are.
So there might be a couple of months window you're saying maybe?
Well, I just honestly don't know. Originally I thought it was going to be sometime this summer probably that it filled up. But I honestly don't know. I mean, it could logistically in January fill up.
Okay.
So it's hard to say. All I have control over is people who sign up in November and December. So, so any other questions? Anybody else? I always tell the anecdote when I go to talk to groups about this, because I've gone to a couple of those employer groups already. When I started the direct primary care membership, I told my sister kind of about what I was going to do. And she was like, I just don't get it. And I'm like, well, of course you don't get it because I'm your sister. And if you have a tick bite in June, you send me the picture. So I'm, I kind of see it like, I'm just going to have a 800 person family to take care of. And it will be great because Lisa will be there. Answering all your calls.
I'm here for you.
That's right. She can handle it. No, not just us, but little team. So it's not for everybody. It's for people who want that kind of relationship with the doctor. And so I'm excited to be able to offer it to people that aren't in one of those big employers. So any other questions? I'm also working to try to get it for littler employers, but I haven't gotten to the bottom of that yet. So keep going. So right now, the best I can offer is this. Now, whether or not group health will marry it with something else, that would be the other thing. So I don't know. Any other questions?
January 1st with the medication.
Yeah, the medication lab starts January 2nd, actually. We won't be open the 1st.
No,
Yeah. So, yep. So those will be the included ones. And that's a document it'll be reviewed every 6 months. So if there is, say, for instance, a blood pressure medicine that's not on there that we want on there, it might get added in 6 months, but that's the kind of startup list. So, and you guys are the first to see it. Nobody's seen it. It's just been
We just printed
15
it
minutes.
like 20 minutes ago.
So, all right. Well, I don't think my video audience has any other questions, so I'm going to turn off the video here. So, anybody else have any other thoughts or anything?
So I guess we need to talk to you one-on-one whether we're going to have our labs done in.
Oh, sure. Yeah. Yes. If there's any specific questions, yeah, we should probably not do that as a group. Are there any more questions that the people of the group should hear? So, yes.
Thank you for hearing that.
Yeah, thanks for coming. Thanks for coming. And
You sure you don't want a chocolate?
Have a good night.
Rephrase that.
Take the chocolate.
Do you want it? Are you going to take it?
So just take it. Sure.
Oh,
Okay, you got to reset that.
I'll take care of it. We're married.
And then someone.
Bye, guys.
Yeah.
Speaking of your
What?
Because
And
what you described me was awesome. And it feels so good. So, I want to keep seeing you.
So, well, that would be great. And but, the nice thing is that there's no, you can cancel it. And then it's
thank you. Take a handful. I'll look the other way. Just take some more.
I think in the very beginning, you'll be a little big.
Oh, he is.
But
look the other way, Ray. Look the other
within a few months, it'll be, pretty quickly.
Oh,
back to
goodness.
kind of the same pace. Like when I looked at the records.
Yeah. Yeah, for sure. Just fold up that chair. I can look for you too.
So I think that, it's something that
We don't know for sure.
Do you need like a little mascot or anything?
But we know what other
Okay.
places are experiencing, and that people are feeling that they're well cared for and not necessarily having to come in for a full visit when it's something that can be taken care of over video conference or call or
Things can be done with them.
right. Yeah. So if you're part of the, so say for instance, like a common one is we get like people like, I've always had bladder infections, I know I have bladder infections, will you just take care of it? Something like that. Okay. That you otherwise. So eventually we're, here's worth of.
Really, whenever. So
One
you
is
would
like,
district
I
on
got
to do more of a
So
you would be a certain like this,
Oh,
right?
uh-huh.
So our December, but like
like say I broke my leg,
call us and say,
Well,
yeah,
then I
remember,
still have to go
get
to
in,
urgent
get
care.
in, right?
So I
Well,
And if it
I
is
mean,
like
I would probably see you and we'd probably split it and we'd probably see right away.
Well, I did
Which urgent care is gonna do anyway.
Okay. Okay.
But if it was something
Okay.
like,
Well, because
be an
my,
X-ray because we didn't know being surgery.
it comes at a bad time because my
You
prescription
know, I mean,
ends
it's hard to say
or
yeah.
is
because,
expiring and I run
you know,
out.
I'm
like,
so used to
towards
kind
the
of
end of January.
tailoring it.
Oh,
to
should I come in
everybody's
December?
individual
Should I?
Okay.
Stuff,
Okay.
But a lot of my labs are
it's hard to
included on
say
there.
in general.
Yeah.
They are.
Join.
So your
I'm not a
prescription runs
circle,
out.
I'm not a circle
But-
So let
member.
me
I
just.
mean, it's hard to know for sure what's gonna be the best option for people.
I'm really good at doing
Just for
it.
this-
Yeah,
Really
it's
good
really
at
gonna
doing
give us a lot of stability, it's gonna give me a lot less of the administrative stuff to do.
Yeah,
So I can
Norris,
focus on taking
yes.
care of people, you
Makes
know.
sense.
And so, because a lot of my time now is like, you know, how do we get people in? Like, how do we get them to call something other than the number they've always called?
Yeah.
And so it's nice to be able to give that up. Because that's now my passion.
Yeah, so it runs out in December?
So,
Well,
I mean, I don't mind it
changed
as
the
much as I did 6 years
prescription,
ago,
so-
but.
Yeah.
And then all of these prescriptions you said would be available here, like you
Yeah.
they'd just be dispensed, you don't have to go to a
Yeah, there's.
pharmacy.
there's
So
like a
what you could
barcode
do
system
is
that
you
is
could
all in a
join
lock
now.
cabinet. And,
You have your
Obviously
prescription
it's not
until,
but it's a lot.
in January, you could be seen in January,
So-
get your
And
labs
so
done,
it's nice to
and
know
I
that
think zero on
those would
there.
be free.
Yeah.
You know, if you need it. So I mean, I really do believe that it's really more urgent care.
That's what
True.
it seems like, yeah, that's something I could get, it's my thyroid check.
Right.
It's a huge thing.
Yeah, and even like if you know, I commonly do free T4 and free T3, and those are gonna be like $10 tests now instead of $40 tests. So it makes, you know, care a lot more affordable.
Yeah.
So that's, it's kind of,
It seems to make sense.
a nice way that
Yeah, I guess people
simplify
are
our lives.
Do you
So,
have,
But like I said, we revamp it every 6
pretty
months,
much
so
like your clinic ready, like all plans out
something is
before
it being used or
yeah, you
So
know,
we're
I
just
have,
gonna kind
I have heard
see,
that
I guess.
it's almost
Um,
close to
so,
like the plan.
if you're good until
but I have not
January,
personally seen it.
then
I've seen,
if you don't need
what
to
the
be
Oklahoma ones
seen in
look like,
November and December,
and
then
they're
we're
very
gonna
much
call
like
it
a-
the end of December
like a
to get signed
central
up. So
desk, and in
essentially,
the back of it, more of a
yes, if you want to save a couple
nursing
dollars,
space.
you sign up
and then a
in
room
December,
inside.
so $4.99
But
and
it's,
then
it's only
$75.
twice as big, so it's not.
So if you
gonna
join
be
in December,
So
we're gonna
Solidarity
pay
is
$38.
plans all that
$199,
for you.
$75,
Okay.
$274.
I was just gonna mention, I do clinic.
Oh, that's
furniture.
right, yeah.
So I was gonna
benefits.
throw that out there
Yeah.
once,
Yes.
but we do a lot.
That's right.
But
Yeah, I have
we
no
already
idea
get
who
the
they
system and
use.
everything,
I
so
don't
then from January second, we'll just kick you
But
right in.
I'm happy to take your card. and
Yeah,
show,
sure.
because I know, okay, I don't know, I would think that they,
Right, whereas if you join
are
in
gonna do it exactly the
January,
same way
then
that
you
they
have to
do it
pay
somewhere else.
Right.
Yeah, I don't know how much freedom you have to kind of make it your own.
So
or if
we
you
would
have
say,
like
essentially
that.
save a couple dollars.
Right.
They look the same everywhere.
Yeah,
December,
that's a good question, I don't know.
we're closer to Christmas stuff, but if you join like December
Yeah.
30th, then they were
Your card.
December 30th.
Yeah.
Not full until January,
Yeah, very cool.
right?
So I.
See, I'm really good at working things.
Yeah.
So, I mean,
I'm gonna see
and then
what
you would
it
be,
is.
like I said, you would make your appointment for January and get into
I
our
think
prescription runs
Actually,
out.
Mark, the CEO. is the
And
one
if for some
working
reason
on
you
the
are like,
design, but
Okay.
in now, then.
Awesome. All right, thanks for having this info
Yeah.
session.
Yeah, and thanks for coming.
Yeah.
Good to see you.
Yeah.
Hopefully we'll
Yeah, and
see you
thanks
around.
again for that.
Literally, like, the first interviews, I was like, we're continuing, this is gonna really do anything.
Uh-huh.
And then last week.
So we're setting up our EMR right now.
I was just like,
Because we like
oh
just
my
signed a
gosh,
contract.
like, I
Just
just
sent it
feel.
2 weeks ago, but we've
Better.
got all this information out to everyone.
Yeah, I know.
So our EMR is not set up yet.
I don't know if you've ever taken
Come
it to
December, I think
I can keep you.
beginning early December.
I usually don't have that problem, but so you
Okay.
keep all of the same stuff.
So,
December. Just
Yeah, I'm in a little bit of discussion with them about
Like,
that.
December,
I think
and then you're
when
like,
we move,
okay.
yeah, I mean, you have the
So-
link already ordered.
Yeah.
Right? Yeah, so that will stay the same.
So yeah,
Okay.
we
As far as
you know,
keeping in
existing
stock.
circuit members, like I said.
Okay, but you'd still
You guys
prescribe
already know
more
donate,
natural.
you guys
Yeah.
already know this program
Okay.
and everything, whereas all those other
Okay.
people, and
Okay.
they don't know
Good to
her,
see you.
and they're not
Yeah,
really
you
out
too.
to
Have a
like
great
get
day.
it,
Enjoy
get
your
it going, you know?
Yeah,
Whenever you
it's
start something
nice.
new, they're just like, oh, I don't really know who she is, I really want to, but if you guys know who she is, you're like, hey, I want to go, you know? So,
Well, I also know there's a lot of people who need things for January,
right, exactly.
who don't even have their cards yet, and they're calling to get their prescriptions read.
Right. So yeah, and then the other thing is if you were to join in December, obviously these labs aren't included in December, but they are at like a super low cost. Like Circumwonder is, the lipid is 10, A1C is 20, a CNP is 20, a CDC is 10. So it's pretty much, the majority of them are either $20 or $60. So,
But yeah, they would be included once January
Yeah.
rolls around.
Best BS ever. 104.
Oh, nice. I thought you were talking about my talk. I was like, what?
I was like, no, blood sugar. She just took her blood sugar.
That's awesome. Good job. Not taking
So
some
then I
shots.
can think about that. I'll keep my
Yeah.
phone
No, right, and then
I'll
gotta
just
go
decide, like the first couple weeks of December.
Yeah.
Oh,
I called my husband, I said, John,
Going,
you know the
right,
flag
right.
days that on the break it every quarters go snicker.
Right. So yeah, if you come in to see Carrie in December, if you join up, you can join that day too.
That's the only,
You know,
that
not
is my
that
week.
day.
I
Otherwise, if you don't join, it's just see Carrie in December, it's $100 visit and regular cost.
And that was.
Because you don't want me to do anything now, if I don't want it to be effective until December.
Let's do it.
I mean, I can set it to pull and everything, but
Uh-huh.
I just sometimes in terms of like setting things up. to
Oh,
be
wow.
Proactive in the future, so
All right.
just kind of do your deciding on like what do you want to join,
And
and we can chat more about that.
I
Oh, okay. And is she not gonna be continuing then?
No, Carrie will not. So she works full time at Yale, and she's like, it just would be so much. And they are like, well, we don't want someone here that can only do 4 hours. You know, we want someone that can build a relationship with patients. So she's like, I'm just fine, and take Thursdays off. And I'm like, hey, I wish I had Thursdays off. Like, you know. So yeah,
Good for her.
I know. I was like, all right.
Sounds pretty amazing.
That whole time and do this too. Yeah, I know. She's like, good for you.
Okay, but then otherwise, so if I come in like the first week or two. in
Good job on
December,
your.
Yep.
oh, okay to cancel my.
He is good too.
Oh, good.
January.
Yeah, I'll come and get my.
Yeah, you're fine to just let me know.
Okay.
Those 30, that's just fine. Just let me know.
Yeah.
But yeah, like I said, the later in December you
Review.
join.
All right. Sounds good. Have a good night.
I just wanna make sure I get my appointment before
Yes,
my
yep.
prescription.
So
runs
Jody,
out.
when will we be able to start booking in January?
Oh, I imagine, when we have training.
Yeah, I said,
December
like,
16th,
middle of
that's probably when it'll be
December.
all loaded. Yeah.
Oh,
Yeah.
December 16th.
Yeah.
Yeah, I said,
So, but
Mike
I
was
mean,
optimistic about the beginning of December, but I told him, I was like, let's just go middle of December.
I'm guessing training week.
Yeah, so,
Oh, yes.
yeah, so middle of December, we'll probably be able to book into January, so. Perfect.
Awesome.
All right.
Absolutely.
Super. Any other questions?
Great. Had a good group.
Did you post that Zoom like on Facebook or?
Oh. I did not, but I think I can share it.
Okay.
Can I share it on Facebook?
Zoom is new.
Maybe ask for a private message with an email, or do we? I don't think we have that person's email, because I know I can email it. Oh, I think it's still recording. See ya.
Really?
Yes.
Oh boy.